This presentation is all about Career as a Physician Assistant by Stephanie Grable. So to start off, what is a physician assistant? Basically, a physician assistant is someone that works under a physician, meaning a PA doesn't really have the authority that a physician has, but they do the same things similar to a physician. So, some things a PA may do is perform physical examinations, interpret and evaluate diagnostic data, establish basic treatment plans, counsel and educate patients, and respond to common emergency care situations, plus much more involving patient care needs. PAs have a wide range of work and can even operate on small surgeries. The working conditions. Working as a PA, you mainly work in a team. So, really, with any healthcare career, you work in a team with other healthcare workers. It's all a very collaborative atmosphere where everyone comes together to really give the ultimate best patient care. PAs mostly work with the physician, nurses, surgeons, and any other healthcare providers that might impact what a PA does. Where can PAs work? So obviously PAs are found in many different units in a hospital. There are so many different sections in a hospital that a PA can work in. Some are the ICU, the NICU, PICU, ortho, oncology, PC units, etc. There's just different sections, let alone in a hospital. But other places besides that are a nursing care facility, urgent care centers, surgery centers, rural healthcare facilities, and even private practices owned by physicians. So really, physician assistants get the benefit of choosing a section of their job industry most fitting to them. So whatever they prefer, they would like to specialize in, they really get that ultimate choice. Training and qualifications. So, the biggest difference between a PA and a physician is that a PA's schooling is 2 years shorter than a physician. So, PAs go to a 2 year program after their bachelor's, while physicians have to go to a 4 year med school. So, PA school is a full time study of human anatomy, physiology, clinical medicine, pharmacology, and much more in this 2 year program. But getting into the program, you are required to have your bachelor's degree, and along with that, you have to have 500 to 1,000 hours in a hospital setting as a patient care provider, meaning you are a nurse tech, an RN, and an EMT, something where you are actually working hands on with the patient, not like volunteering or working in a cafeteria type thing. So you really have to be hands on to be qualified to get into the program. So, the salary of a PA. The entry level rate of pay for a PA is about 75.2K to 121K per year. And that wide range is due to the scope of practice that you go into and or the state that you work in. Average pay rate goes about 101,480, so that's about the median that PAs will make. The best pay rate, though, with higher levels experience, make about 124,200 a year. So, in this little table diagram that I have here, it shows how the salary by practice area changes a good amount. So an orthopedic surgeon makes about 122,864 a year, while someone who only works in pediatrics makes 99,167 a year. So that pay range really just is different on the practice area or which state or hospital you are working in. So just a couple interesting facts about being APA that I thought I would throw in there. According to Barton Associates, the educational model for PAs was based in the part of the training program for new doctors who served in the battlefields in World War II, which is pretty cool. According to Becker's Hospital Review, PAs are able to prescribe in all 50 states, but in 14 states, some limitations are based on the types of medications PAs can provide. So they can actually prescribe certain medications. And last thing, PAs are increasing in number and scope of practice. So really there are now more than 108,000 PAs across the country, and they are increasingly taking over on a greater role given doctor shortages in certain areas. So they're really taking that step up and becoming a more known career.